Hi, this is Dr Eyetemou Miguel, your pharmacist, and in this new video we are going to talk about a very important theme, which is 12 scientifically proven tips that you can adopt to prevent cancer, to reduce your risk of getting cancer. Why is it important to prevent cancer in the first place? Because you have to know that cancer is the second major killer worldwide after heart or cardiovascular diseases. So cancer causes something like 10 million deaths per year worldwide. And the WHO says that something like 30 to 50% of cancers is preventable. So it's important. Almost half of all cancer cases is preventable. So it's important then for us and for you to know what you can do practically to prevent cancer. So let's talk about those 12 tips. Now, these are not things that will prevent a cancer 100%, but these are things that you can adopt, habits that you can adopt in your daily lifestyle for you to have reduced risks of cancer. So let's start right now with tobacco. The first tip is to avoid tobacco. If you are smoking, you have to quit smoking, because the sooner you quit smoking, the better it will be for your overall health, and mainly for your cancer risk, because tobacco is a known risk factor for a lot of cancers, such as lung cancer, mouth cancer, throat cancer, pancreas cancer, kidney cancer, and blood cancer. Number two, you have to eat more cruciferous and colorful vegetables. It's very important, and there are some studies that suggest that cruciferous vegetables such as Brussels sprouts, broccoli, cabbage, kale contain chemicals that have anti-cancer properties. So if you want to decrease your odds, your risk of having cancer, you better eat of those veggies regularly. Number three, you have to avoid processed meats, which are found in hot dogs, bacon, sausages, because they are rich or they are high in nitrites and nitrates, which are known for their cancer promoting properties. So you better go for safer alternatives of meat such as fish and chicken. Number four, you have weight. If you are obese, you have to lose some weight. Very important, because fat cells are known to produce chemicals that will promote cancer growth in your body. Number five, you have to move more. Don't stay seated for too long. Don't stay inactive for too long. You have to move. That will also help you to prevent or not to get obese, and also help balance your hormones such as estrogen and insulin. Number five, you have alcohol. So you have to limit your alcohol intake or completely avoid alcohol at all. And you have to know that recent studies suggest that there's no safe amount of alcohol. Alcohol is a known risk factor for cancers of the mouth, of the esophagus, of the liver, and of breast cancer, among others. Number seven, you have to be careful with sun exposure. It's important for you to get some sunlight, because it will help your skin produce vitamin D, which is going to make your bones stronger. And if you want to have more tips on how to strengthen your bones, you can go and check my previous video on 6 tips that you can take, that you can do, six things that you can do to improve your bones health. So talking about the sun, if you are sensitive to the sun, you can use sunscreens on your skin, sunglasses, protect your eyes. or wide brim hats that will cover your heads properly. Number 8, you have sex. You have to perform safe sex, because unsafe sex is going to bring you sexually transmitted diseases, and a lot of sexually STDs will increase your odds of having cancers. For example, hepatitis is going to increase your risk of having liver cancer, and human papilloma virus, HPV, is going to increase your risk of having cervical cancer because it is involved in 70% of those cancers. Number 9, you have to get vaccinated. So vaccination is important. For example, HPV, that will help you reduce your risk of cervical cancer, cancer of the vulva, cancer of the vagina in women, and vaccination against hepatitis B, which is going to reduce your risk of liver cancer. Number 10, you have to avoid carcinogens, which are toxic chemicals that might promote the development of cancer, might promote cancer growth. So these chemicals are asbestos, benzene, and radon. Number 11, you have to check your family history to learn about people in your family who might have had cancer, and to talk to your doctor if you need a genetic test to assess your risk of cancer. And number 12, you have to be up to date in your screenings. This concerns mainly women, so they have to perform pap tests to check their risk or the development of cervical cancer, and also mammograms to screen for breast or lung cancer.